Okay, well, a common question we get is, gee, Dr. Rutledge, if you're so smart, if this is such a good surgery, why isn't everyone doing it? What is the deal? Why do all the other doctors in the United States have concerns about the mini gastric bypass? And the answer is pretty simple. It's bile reflux. And so if you talk to other doctors, they go, yikes. Patients of Dr. Rutledge are all going to suffer terrible bile reflux. And so, first of all, you can real simply just call hundreds of my patients. Just, dial them up, email them by the hundreds, thousands, and say, do you have bile reflux? And what you'll hear, I think, from thousands and thousands of people is no. Now, it's a little bit more complex than that because the doctors are not wrong when they're worried about bile reflux. Basically, bile is part of your digestive system, and as it comes by the stomach, some of it could wash up backwards into your stomach and irritate it. And so the other doctors in the country appropriately are worried about that, and they say every one of my patients will suffer tremendously having this bile washing back up into the stomach. And what we say is, no, this type of surgery has been done for 100 years. It's done about 16,000 times a year in the United States for other illnesses like gunshot wounds and trauma to the stomach, ulcers, gastric cancer, stuff like that. So we use it all the time, but it can have problems. It can get the ulcer or gastritis or irritation we talked about earlier. Now, if I see one of my patients who has an upset stomach or gastritis or irritation or an ulcer, I believe and I think they have an acid problem. An anti-acid treatment would work for. The other doctors, if they see irritation and see some bile, they go, aha! Here's one of Dr. Rutledge's failures. This is bile reflux, and the patient needs to be treated with a Roux-en-Y gastric bypass. And so there's actually a paper from North Carolina where some surgeons saw a few of my patients with an upset stomach and gastritis or an ulcer, and they operated on them to treat them with a Roux-en-Y gastric bypass, which is a good treatment for bile reflux. Now what I say is I've got 5,000 cases over 12 years, and many of my patients will have some upset stomach, will have some gastritis, and may actually have an ulcer, which you and I talked about. And what we say is it's probably from acid. And we treat those patients when they call me with Prilosec antacids. And what we found is they get better. So my belief is, and what I see in thousands of my patients is, that if you have an upset stomach after the MGB, it could happen. It's our most common problem. It's usually from an acid kind of problem, and antacids like Pepto-Bismol or Tums or Prilosec, yogurt, things like that seem to help. And by doing that, in 5,000 people over 12 years, we've only had 3 where we thought we had really bad bile reflux and had to have surgery. And if they had to have surgery, we found we could fix it in about a 15-minute surgical procedure, laparoscopically. But 5,000, 3 people. But if you go to a Roux-en-Y doctor, they're going to say they honestly believe that bile reflux is a big problem, and they will jump to operate on you and say that they need to because of bile reflux. If you believe that, there's no problem. Don't have an MGB. We think that it's an uncommon problem. God forbid if it ever did happen to you. You can always choose to go to a Roux-en-Y, but you can't choose to come from a Roux-en-Y back to an MGB. It's not a bad decision. I don't think that the doctors who believe that the Roux-en-Y is best are not bad doctors. They don't have anything against anybody. They're just, that's their belief, and they're worried about bile reflux. I have thousands of people over 12 years, and I don't see what I think is much bile reflux. I do see people with upset stomachs, and I give them antacids, and I think that's a better treatment than a Roux-en-Y. Some people say, well, why don't you do a Roux-en-Y in the first place? And the answer can be described in part by thinking of every major celebrity that you can think of who has a Roux-en-Y. Just think of everyone you can name, and maybe you can name some that I don't know, but I think of Al Roker, Roseanne Barr, Randy Jackson, Carney Wilson, all those people who've had Roux-en-Ys for more than a couple of years, they're all gaining their weight back. And they probably all have pretty good money, and none of them are going back for a revision to have it fixed. So I say Roux-en-Y, high failure rate, high complication rate, and not very easy to revise. MGB, in controlled randomized trial, better than the Roux-en-Y, easy to modify, more effective, and more durable. Maybe might have a higher risk of bile reflux. I don't think so, but if it does, you could always choose a Roux-en-Y, but you can't go from a Roux-en-Y back to anything else safely. So it's a little subtle, but I'm not crazy about the Roux-en-Y. I wouldn't offer it. I think the MGB is great, but not perfect. I think when the other doctors see a patient of mine with upset stomach, they go, aha, bile reflux. And if I see somebody with an upset stomach, I go, probably a little antacids should make it better. Is that?
Yeah. Thank you.
Okay. It's a really good